I'm Dr. Sarah Manneh. I'm happy today to come on and talk about some of the new menstrual products that are out on the market that are used for periods other than tampons and pads. I'll start with the menstrual cup, which I think is probably the most common of the things that people see and are really wanting to try and use. A menstrual cup, if you think of it, is a bell-shaped silicone or latex collecting device. And if you took the bell of that shape and turned it somewhat upside down, that collecting wider part of the bell is what's collecting menstrual flow. So it's been out for quite some time. Probably one of the more common names, called the Diva Cup, is what many women are using, along with now some, I think, 20 different brands. They do come in certain sizes. Menstrual cups usually are sized 1 or 2. Some are sized as 0, 0 being in a teen, in a young woman who's never had a pregnancy. In sizes 1 and 2, it really is dependent on whether you've had a birth vaginally or whether you have not had a birth vaginally. Even in C-section moms, I would recommend starting off at a 1, and moms who had vaginal births at a 2. And that's pretty universal sizing in these cups. Silicone or latex, so if anyone has an allergy to those type of plastic products, that is what these are made of. Cups, they are reusable. So the whole point is reusable. They can go up as much as 6 months for use before they need to be removed and then thrown away. Basically, the menstrual cups are used for as much as 12 hours inside the vagina to collect menstrual flow. We typically will have a patient who is interested in these place them, and they're placed as high as they can go up into the vagina, where the cup at the rim would then be squeezed to place it as high up as it can go, and then it would be released, and suction would allow for that cup to adhere. Usually at the cups, and here's one right here, the cups will have, and maybe it's hard to see on this box, but there is a stem at the base of these cups, and the stems vary. This is what is used to pull the cup out of you. So there's a stem. When you're ready to take the cup out, you want to get, again, your hand as far up into the vagina, actually break the seal, and maybe with the second hand pull down on the stem. Or if the seal's broken, sometimes you can just pull the whole thing out. So that's how this particular one would be removed. There are other ways to grab the menstrual cup by using, some of them have a little hook, or they have a little finger ring where you're pulling it down. Depending on how comfortable you are in bringing this down, as a starter cup, if you're trying to use it for the first time, you may want to use one where there has more of a grab or ring to it. But this is an example of them. They all come with a little storage pouch, and that's used for discretion. Once it's in you, the cup, and your flow is at a point where you feel like you need to remove the cup and empty the cup is basically pulled out, menstrual flow is emptied into a toilet, and then it's typically rinsed with warm water and put in. If you're not at a point where, say, you're in a public restroom and you can do that while you're in a stall, it can just be wiped gently with toilet paper, making sure that the toilet paper isn't adherent to the cup, and just put back in. Some women will step out of their stall. They can rinse it, go back into a stall if they're in a public restroom, and manage it that way. But that may be just one of the more inconveniences of a menstrual cup in using it. The huge advantage of this is it's obviously not a product that's going to go into the earth. It's earth friendly. It's not where tampons and pads are being used and are contributing to overall waste. It is comfortable for many women who wear it. It can be used at nighttime. The risk of toxic shock syndrome, those are minimized with these type of products. And so it's quite easy to use. I can segue into another option. That option is something called a menstrual disc. A menstrual disc is a little bit different. It's shaped like a disc. Why a woman would want to use this is if she's not able to size herself with a cup and also does not like the seal to the cup, and it's been difficult for her to remove, she'll go to a disc, and the disc is basically such exactly like that. It is a wider basket, basically much more flexible and slightly, of course, wider in what you see here, and you place it into the vagina and you let go, and there is, like I said, no seal. The collection mechanism is a little wider here, so women who have had babies before vaginally may find these to be more comfortable. These are not sized, so it's a one size fits all, so no 0, 1, and 2 sizing. The biggest difference with this is that its length of time for use is not going to be up to 6 months. It's probably going to be at best a week to 2 weeks. These usually come in a pack of 6 or 7 in a box. So I would probably recommend using it per cycle. These can be rinsed, warm water, just like the menstrual cup. The other big difference between the menstrual cup and this is you can see that there is no pull option. You have to grab around the ring, which is much more flexible, and again, not a suction, and so it should be easier to pull out. There is also, very different from the cup, something called an auto dump mechanism, which means that when this disc fills itself and the menstrual flow is at the top of the disc, it will release menstrual flow and it will self-empty. Also, with women, when they're in the restroom and they strain really hard, they can self-empty without pulling the disc out as well. If this overfills and you're not in a restroom, though, you have to be careful because you may leak and may need secondary protection like a pad or a tampon if it's going to auto dump when you're not in a restroom. These are all fairly cheap. I would say the cost of a menstrual cup is a little bit higher. It can range from $7 to $25 and it's reusable. A box of discs would probably run you somewhere between 10 to 15, but it would be not as reusable in that length of time of 6 months. But these are the newest products out there, and I think a lot of women are being very earth conscious and wanting to use these products. These are safe, and I think that they're great options for women of all ages. Just a little bit about the risks of having a menstrual cup or menstrual disc. There are certain people that you want to counsel appropriately to make sure they're the right candidates. But specifically, again, if you have a latex or plastic allergy, you don't want to use these products because it will create an allergic reaction that could be very hypersensitive to you. Also, if there's been a documented history, and again, the risk of toxic shock syndrome is so rare today in this era. It used to be more common with tampons that have been retained, but if there was a person who had a documented history of that, you would caution them to use these, just an event that puts them at a higher risk. Also, IUD wearers, people who use IUDs, they can use these products. If you've just gotten your IUD inserted and you're wanting to use a menstrual product like a cup or a disc, I would recommend waiting about 4 to 6 weeks after your IUD is inserted, because that's the time in highest that your IUD could be automatically expelled or dislocated if the uterus is trying to work out your IUD, which again, that is rare. But you don't want to put in a cup or a disc and then the potential for that IUD to fall out after a new placement of an IUD. The other thing to keep in mind is if you are a long-term IUD wearer, it's not been a new insert, you have strings that your provider has seen before and has seen with your appointments, it is possible if you have a cup that has suction or seal that unintentionally that cup could potentially bring longer IUD strings down and pull your IUD itself out. So in disc wearers, they don't have that suction seal in the collection mechanism of that device. But in cup wearers, they have that seal. So you may want to ask your provider if the strings are long, if they would recommend to trim those a little shorter so that you can be wearing a menstrual cup, and you're then not going to be at risk for pulling it out. I'm going to segue a little bit again into how these are cleaned, because I think that's important. There needs to be no heavy deodorant soaps or detergents or bleach with these products. In fact, some of those will be harmful to silicone and rubber and can degrade those more so over time. All you need is warm water rinses and air dry. The first time you're going to use your menstrual cup, you'll want to boil it because it's silicone and latex. You want to take that factory product off the plastic before inserting. That's in first time wear, and then subsequently after that, you can do warm water rinses. Your cup is going to be old and ready to be thrown away when you start to see a lot of discoloration, but discoloration is normal. If there's an odor to it, if there's any breakage of the silicone or latex of those cups, obviously that's a time to get rid of your cup. You will see less of that with the discs. The discs are mostly just a ring with a clear plastic basket. Very rarely are those going to degrade or change in color, but the cleaning of them is the same. And again, you just don't want to use heavy detergents, soaps, bleach. I mean, those products will hurt and degrade these, but it also will cause potentially vaginal irritation and an infection.